as we age, we can lose elasticity in our veins, which affects the blood flow in our legs. And we are here with Dr. Skibba to talk about what Premier Surgical Vascular and Vein Center is doing to help those with those bulging varicose veins that some of us deal with every single day.
Yes, yes.
Absolutely.
So the different things that can cause these painful veins, there are different types of deep vein problems such as blood clots called DVTs, or different types of vein compression problems in the belly and the pelvis. There are also veins that are right underneath the skin that can let blood go backwards called reflux, and there's a bunch of different things that can cause that. Age, as you said, with each decade of life, these things become more common. Genes, these things do run in the family. Gender, specifically the female gender, is about 4 times more common with women, particularly women who have had multiple pregnancies. And then, of course, occupation. People that spend a lot of time standing in one position or sitting in one position throughout the day are more prone to develop these types of vein problems.
And doctor, this is actually something that I've dealt with my entire life, runs in my family, but you guys are doing something big here that's new and helping individuals in the local East Tennessee communities deal with those problems.
Yeah, so there is a newer vein treatment called VenaSeal. It's by Medtronic. I'm going to show you the delivery system here. It's basically just a device that delivers sterile super glue that's flexible, that's used to scar down these troubled veins. Now, the difference is that there are a number of these different vein treatments that use a thermal modality where it basically burns or scars the vein shut. With this type of system, it's considered non-thermal, and so there's a couple benefits to that. One being that the procedure itself is less painful because we don't need a bunch of needle sticks up the length of the leg to encase the vein in numbing fluid because it doesn't use any heat or anything that would hurt. And then for that same reason, the recovery time is a lot shorter, and that's what the studies have shown since it came out in 2015, that these particular procedures have the same exact outcomes, but people get back to their daily lives a lot sooner.
Absolutely, and I think that's one of the biggest things that people think about. Is it outpatient? Can I get back to my life?
Yes.
So who would be a good candidate for this procedure?
Yes, so really anyone who is symptomatic from their vein trouble, and those symptoms include swelling, aching, heaviness in the legs, painful or itching varicose veins, discomfort in their legs in the evening or at nighttime, restless leg syndrome, and the worst manifestation is having a wound somewhere between the ankle and the knee called a venous stasis wound. Anyone who has those types of problems is a candidate for it.
Absolutely. And another huge question I'm sure you guys always get, is it covered by insurance?
Yes. VenaSeal is covered by insurance, as are all the ablation procedures. There are a few insurance companies that only cover certain ones, but VenaSeal is covered by most of the major carriers, including Medicare.
Absolutely. Well, that's huge, and that's great news for everybody as well. And where can people go to find more information about this procedure?
Yes.
And even learn more about it from you guys?
Yes, so from premiersurgical.com, on our website we have a bunch of information, and if anyone has any questions, they can either get referred from their primary care provider, or they can self-refer and come to our office directly and speak with one of our vein specialists.
That's fantastic. And one last question. What advice would you have for people out there kind of suffering in silence from this that might be afraid to do it, or seeing this and is thinking, hey, I might be a great candidate?
Yeah, so I think the most important thing to do is when seeing a specialist for some type of a problem, to make sure that the practice you're going to has comprehensive care for that particular issue, where specifically there are a full spectrum of problems that can happen with the veins, with the blood clot in the veins. We will take someone to the hospital and remove that clot. If someone has a venous compression problem, we have the x-ray equipment and balloons and stents to open up those vein problems. And then, of course, the things that we're talking about, the more kind of chip shot varicose vein procedures, we do all those too. So the entire spectrum will be addressed and corrected in a practice like Premier Surgical, where we can deal with the entire spectrum of disease.
Absolutely. Well, that's huge. It's great to know that you have a full spectrum of care here right in-house and can deal with all issues. So thank you so much for joining us today, and thank you so much for what you do in the community. It's awesome.